Welcome everyone. So my topic is rational pharmacotherapy and the pharmacist's approach toward evidence-based recommendation. I think it's not a surprise I'm a pharmacist. And my vision is to have educated patients in the world. Therefore, I want to be a co-character in internationally recognized patient education programs. For this, I worked about two core things. The first is about nabiximols, and it's the question of whether we should give something to a patient. And the second is some kind of an opposing question, whether we should avoid some kind of treatments. So, let's go on to nabiximols and whether is this efficient as an add-on treatment for patients with multiple sclerosis associated spasticity refractory to standard treatments. We are in the state of a draft finished and in the brink of internal review, but still not in this case. But what about the background? About 2.8 million people suffer from multiple sclerosis around the world. From them, about 28% have spasticity, which responds inadequately to standard treatments. And here comes nabiximols. It's an emerging agent, and yeah, it's in some place of the world accepted as a medication against spasticity. But still, nabiximols is not in the general treatment of resistant spasticity. So, here comes the question. Does nabiximols improve the symptom of multiple sclerosis associated spasticity? And our hypothesis is that yes, it can. So, here is the selection process, and we started from about 3,000 articles and arrived to 14 eligible one. And this one is the primary outcome. It's spasticity numerical rating scale and its responder rate. Generally, responder rate is 30% decreasement in this numerical rating scale, but in really short-term treatments, like those with less than 4 weeks, 20% is acceptable because nabiximols need times, and typically after in a longer treatment, they achieve 30%. We have really different study designs. Therefore, I want to highlight the fact that all studies point to one way, which means that nabiximols is good against spasticity. But we have to admit that therefore there's a really high heterogeneity in our study. We made several further analyses, and from them I want to highlight that all the significant results are in favor of nabiximols, not to mention this last one, the subject's global impression of change, which is a global parameter, and it's again in favor of nabiximols. Therefore, we have to admit that nabiximols truly have to have effect against spasticity. So, we have proven the efficacy based on randomized and blinded clinical trials, but we have several limitations, not to mention the already told study design, for example. Spasticity can be alleviated by nabiximols, and nabiximols, therefore, a good agent in the symptomatic treatment. But we advise some research in the future. We need stratification, like what population, what type of multiple sclerosis do we need this treatment, which time frame is it the best, and maybe we need comparisons with, for example, baclofen. My second topic is about nabiximols and whether it's good against further symptoms, not just spasticity. Because multiple sclerosis is not just about spasticity. It has several other symptoms. Like sleep disorders, what I want to highlight, because in the previous study, I've already seen this kind of effect, that nabiximols may have effect on sleep disorders. And investigators typically reported further improvements, not just the spasticity. So, in this case, we want to prove whether nabiximols can improve multiple sclerosis-associated symptoms further than spasticity and pain. Oops. And if we are right, then we can achieve that there will be an agent that can work against a set of symptoms. With this second project, we are still waiting for the title and abstract selection from my colleagues, but we're after the duplicates removal. My third topic is the question of how to avoid something. And in this question, I believe one of the best population is lactating women. Why? Because medicines might pose danger to the baby or decrease breast milk. It's not nice. But the undue rejection of medicines is also really disadvantageous. And if the patient is in the hand of a medical doctor, yes, it's the best state. But what about the case of over-the-counter medication? And especially if it's an online bought over-the-counter medication. So we have to make patient education materials. Okay, but what is the most efficient way where we can achieve the highest knowledge translation in this population? So, the clinical question, what is the most effective way to educate lactating women on the use of OTC drugs on the internet? So, there will be a comparison between video content, podcast, written content, and information leaflet. And our hypothesis is that information leaflet is the best way. But regardless of the result, we will have an answer how to translate knowledge to these population. And after all, we can achieve a rational and safe use of over-the-counter medicines. Eligibility criteria, inclusion criteria for this study would be lactating adult women. I've already mentioned the interventions. And the primary outcome would be knowledge translation itself. We have some draft materials where the colleagues from Szeged helped us really a lot. And you may see a really different style of information translation. But the core points, the information itself would be identical because we made it. So, after all, I believe everyone can see that rational pharmacotherapy have many aspects, and therefore we need evidences to choose the best from medications. And I want to thank you, your attention, by a quote from Albert Szent-Györgyi. Science is based on the experience that nature answers intelligent questions intelligently. So if she is silent, there may be something wrong about the question. Thank you.
Yes, thank you very much, Dénes, for your presentation and also for the research in this topic. I think it's very important to continue research in this topic. The picture, as I saw, which you presented us, is very promising and very positive. But for me, to my understanding, is that nabiximols are still somewhat controversial in society. So did you come across any significant side effects or negative effects of nabiximols?
Nabiximols is typically cause dizziness, somnolence, typically this kind of fatigue, sometimes typically these are the common side effects, if this was the question.
Yes.
Technically, this is why, if you've seen, this is why Bartel ADL, which is measures how patients can walk, for example, on stairs or transfer from bed to chair, is not that good because somnolence, dizziness affects these kind of movements.
Thank you. Some comments, questions about the. My opinion, it's very, very nice and very, very interesting question is about the lactating women. And have you got any? Why do you change this group?
Why do I have chosen?
Yeah.
It's very simple. My wife was pregnant, and after this, baby, and we couldn't find really good materials on the internet.
You've got right. Yes, always the pregnancy and during the pregnancy and lactating women always have got problems with the treatment.
Yes, but the fun fact is that it's easier to find materials for pregnant women than to lactating women.
Maybe, yes, you could try.
When I tried to find, it was easier for me.
Yes,
okay,
yes,
this is the truth.
It's very simple. Okay.
In connection to this, I think we have talked about this before. But I wonder that how can you dissect that in your last study? I mean that with women that the different information sources, because as you said, I mean, when you didn't get the right information, you were looking for different kind of videos, actually written materials, and so. How can you really? I mean, because people today, I mean, they don't stop with one information source because they try to use, I mean, at least me, I mean, try to use different sources. Actually, I mean, that going back to books. Or scientific books and also to scientific information, papers, but you also go to the web, just looking around. So isn't that this difficult or affects your outcome, actually? So this is actually a kind of bias or increase the heterogeneity.
Technically, we have to ask many things from patients. Okay, for the short-term answer, we have to measure whether they used already some kind of information source. In the long-term question, we have to ask them not to use this kind of further information. And yes, we have to measure somehow this, but I believe we can make it, and it has to be taken as a bias factor. Therefore, this is why we not think about only one topic. This is the pilot studies topic, the pain management, but at least we will have 5 topics, and we are thinking about further topics to have further points for the comparisons. So it won't be easy, and we believe that there will be many bias factors that could make the information untrustful, but after all, we will have some kind of starting point.
Thank you very much.